If you have diabetes and you're also struggling with erections, you are not alone. In fact, more than half of all men with diabetes will experience erectile dysfunction at some point. But unfortunately, ED is one of the least talked about complications of diabetes. So today, I'm going to explain to you how diabetes affects your sexual health and, more importantly, what you can actually do about it so it does not impact your sex life. Hi, my name is Dr. Lamia Gabal, and I'm a board-certified urologist practicing here in Southern California. In my practice, I see this connection between diabetes and erectile dysfunction all the time. It's incredibly common, and the good news is there are real evidence-based strategies that can make a meaningful difference. So what exactly is erectile dysfunction? It's the persistent inability to achieve or maintain an erection firm enough for satisfying sexual activity. It is not about having an off night once in a while. It's a pattern that affects your confidence, your relationships, and your quality of life. Now, why does diabetes make erectile dysfunction more likely? It comes down to three main pathways. First, there is blood vessel damage. Diabetes causes damage to the lining of your blood vessels, something we call endothelial dysfunction. An erection depends on healthy blood flow into the penis. When those blood vessels are stiff or narrowed from years of high blood sugar, that blood flow is compromised and the penis can't get enough to maintain an erection. Second is that diabetes can also cause nerve damage. Diabetes can injure the small nerves that signal an erection to begin. This is called diabetic neuropathy, and it affects both the nerves that carry sensation and the nerves that control the automatic relaxation of smooth muscle needed for an erection. Third, there are also hormonal changes. Men with diabetes tend to have lower testosterone levels compared to men without diabetes. Obesity, which often accompanies type 2 diabetes, makes this even worse by increasing the conversion of testosterone into estrogen in fat tissue. And here's something many people don't know. Erectile dysfunction in a man with diabetes is often an early warning sign of heart disease. The same blood vessel damage happening in the penis is happening in the heart. So if you're experiencing this, it is not just a bedroom issue. It's a signal worth paying attention to. Now, let's talk about the 5 best ways to optimize sexual function when you have diabetes. These are evidence-based strategies that will help to minimize the impact of your diabetes on your erectile function. Strategy number 1 is to optimize your blood sugar control. Research consistently shows that higher hemoglobin A1C levels are linked to worse erectile function. One study found that A1C was an independent predictor of erectile dysfunction severity, even after accounting for other factors like neuropathy. So better blood sugar control helps protect the blood vessels and nerves that make erections possible. This doesn't mean perfection. It means working with your doctor to get your numbers into a healthier range and keeping them there over time. Strategy number 2 is to get moving with regular physical activity. A meta-analysis of randomized controlled trials found that exercise interventions significantly improved erectile function scores, with aerobic exercise at moderate to vigorous intensity really showing the strongest benefit. Exercise works through multiple pathways. It improves blood vessel function, boosts nitric oxide production, which is the key chemical that relaxes blood vessels in the penis, reduces inflammation, and can even raise testosterone levels. Aim for at least 150 minutes per week of moderate intensity activity like brisk walking, cycling, or swimming. Strategy number 3 is all about diet. If you adopt a healthier diet, particularly a Mediterranean-style eating pattern, this can be very helpful. A large study published in JAMA Network Open found that men with the highest adherence to a Mediterranean diet had a significantly lower risk of developing erectile dysfunction. In men with type 2 diabetes specifically, those following a Mediterranean diet experienced slower declines in erectile function compared to those on a standard low-fat diet. Focus on fruits, vegetables, whole grains, fish, nuts, and olive oil. All these are rich in antioxidants and those healthy fats that support blood vessel health. Strategy number 4 is a little harder, and this is to try and lose any excess weight. A landmark randomized randomized trials showed that obese men who lost weight through diet and exercise had significant improvements in their erectile function scores after 2 years. A weight loss of just 5% of your starting body weight is the minimal threshold for clinical benefit, but greater weight loss leads to even greater improvements, including better blood pressure, cholesterol, insulin sensitivity, and higher testosterone levels. Weight loss reduces the conversion of testosterone to estrogen in fat tissue and lowers insulin levels, both of which support healthier sexual function. And strategy number 5 is to get a professional involved. Talk to your doctor about medical treatment options. Medications called PDE5 inhibitors, which include well-known names like sildenafil, tadalafil, and vardenafil, are the first-line medical treatment for erectile dysfunction in men with diabetes. There are studies that confirm that these are effective, but it is important to note that men with diabetes may need higher doses to get the best response. If medications for ED are not working well enough, it may be worth checking your testosterone level. Men with diabetes are more likely to have a low testosterone, and replacement therapy in those with confirmed deficiency can improve sexual function. Your doctor can also evaluate whether any of your current medications might be contributing to the problem. Now, I want to be very clear that every person's situation is different when it comes to erectile dysfunction. Your age, how long you've had diabetes, what other health conditions you have, and what medications you take all play a role. These strategies are general guidance based on the best available evidence, but the right plan for you should be developed with your own healthcare team. Here's what I want you to take away from this. Erectile dysfunction in diabetes is extremely common. It's not your fault, and it's very treatable. The same steps that protect your heart and manage your diabetes, better blood sugar control, regular exercise, a healthy diet, and maintaining a healthy weight also protect your sexual health. And when lifestyle changes aren't enough, there are effective medical treatments available. If you found this video helpful, remember to give it a like and subscribe for more evidence-based health information. And if you have questions or topics you'd like me to cover, drop them in the comments below. Thanks for watching, and I'll see you in the next video.